Good morning, everyone. Good morning. It is my pleasure to welcome you all in today's webinar. This is the 5th DiaBeat webinar series in conjunction with our RAC Diabetes Challenge 2022 program. Diabetes disease is one of the biggest challenges today. It is a consequence of family history, inappropriate diet, lack of physical activity, and sedentary lifestyle. With great consideration, RAC Hospital has organized the RAC Diabetes Challenge 2022. The program includes a series of DiaBeat webinars on diabetes management, which provides comprehensive information on the medical aspects of diabetes, advises on therapeutic diets, exercise, stress management, and holistic medicine, among many others. Diabetes is associated with many other complications in our body if left uncontrolled, such as eye problems. For today's topic, diabetes, eye care, and retinopathy, we bring only the best and expert on this subject, none other than our very own Dr. Mohit Jain. Dr. Jain obtained his ophthalmology residency and vitreoretina surgical training from AIMS, New Delhi. He also did an internal retina fellowship from the New York Eye and Ear Infirmary, USA. He has been awarded multiple fellowships, such as the Fellow of All India Collegium of Ophthalmologists and Fellow on the International College of Ophthalmologists, UK. He has been a visiting ophthalmologist at the Massachusetts Eye Research and Surgery Institution in Boston. Dr. Jain's 14 years of extensive experience include more than 5,000 retinal surgical procedures, 3,000 cataract surgeries, and countless intravitreal injection and retinal lasers. He specializes in sutureless pars plana vitrectomy for diabetic retinopathy, retinal detachments, and macular holes surgeries. He is also an expert in latest femtosecond laser assisted cataract surgeries with premium multifocal and toric intraocular lens implantations. He is an avid academician and teacher. He has worked on multiple international publications and meeting presentations. Please join me in welcoming Dr. Mohit Jain.
Very good morning to everyone, and thanks Lailin for such a wonderful introduction. It is my great pleasure that I am presenting on such an important topic with the general platform. So today, are you able to see my slides?
Yes, sir. Perfect.
Okay. So today, actually, I'm going to discuss about eye disorders, which happens in the diabetes. And particularly, I'm about to discuss regarding a disease which can cause loss of vision. Loss of vision, which is irreversible, up to extent that it can cause blindness. So it sounds scary. But the good thing, this disease we can prevent with timely diagnosis. And we can treat the loss of vision, and we can even revert it back. So this disease is known as diabetic retinopathy. We will discuss in detail about this particular disorder. So first I'll discuss about why this happens, why the diabetic patients develop diabetic retinopathy, and how common is it? What are the risk factors? What time we should check? And how are the treatment strategies available? How the treatment effective in this particular disorder? In my clinical practice, I observed that between 30 to 50 year of age, the normal working adults who are active in their work, who are the breadwinner for the family, they feel that they are too young to get this diabetes disease or any complications. They feel that, yeah, the blood sugars are high, maybe because of the work stress, not taking proper meal, lifestyle, and they can manage it very well. So this working adults are having a very hard time to realize that they are suffering from diabetes, and that may lead to some complications, including the loss of vision. Irony is around 10% of the adults, I'm not talking about the sick people, normal average general population, adults, 10% are having diabetes, around 10%. That is a huge figure. 1 in 10 normal adult which comes into the hospital is having a diabetes. And out of 3 patients who are diagnosed as a diabetes, 1 patient is having a diabetic retinopathy. So we are not discussing something which is very rare. Rather, we are discussing a thing which is quite common and which is oftenly causing the loss of vision. So you may say that this is the international data. It is not like this, like, the most of the people, it is very hard to realize that. They say that is a Western data. Fortunately, I have some, fortunately or say unfortunately, I have some studies which proves that it is very common in our surrounding. One study done in Northern Emirates, including the Russell Khema, where around 900 UAE citizens were recruited, and they find that around 25% of the normal adult are having diabetes. So look, people say that, yes, this is diabetes is because patients are not having a good health care. They are not diagnosed properly. But believe me, UAE is having the best of the best healthcare. I have a personal experience in India. I worked in US. My colleagues works all over the world. We have a huge interaction, and I can claim this that the UAE is having the best healthcare facilities, and for the normal local Emirati patients, it is readily available as well. But why it is more than the entire world? Entire world it is 10%, but here it is 25.1%. I'll come to this point. Patients who are having diabetes, they were again checked in the UAE, and they find that 20% of them having a retinal involvement. The rest of the world it is 10%, but here it is 20% of the diabetic patients are having diabetic retinopathy. And now I come to the point, most of the patient, around 75% of the patient are not aware of this condition. So it is not the poor healthcare, it is the lack of education that is causing the diabetes and its complication. And that is the sole purpose of this webinar, where we come and interact with the general public to aware them that though you have the best healthcare facility, you have all the resources to be healthy, but it is the lack of education that is affecting us. There is a saying that if you know the enemy, here it is the diabetes, and you know yourself means your weaknesses, your lifestyle, your BMI, your risk factors. If you know these 2 things, you need not to fear for any results of the 100 battles. So probably hopefully we will serve our purpose and will educate you about the diabetes and how can we prevent it. Let's come. So we have heard about this word diabetic retinopathy. So let's see what is retinopathy, or what is retina and how it is affected. So in very simple words, our eye is like a tennis ball. The small part of this tennis ball is visible, that is the white part sclera. The colored part is the brown or black or the blue is the iris, and there is small aperture in between, that is the pupil. Inside this tennis ball, there is a lining. This lining is like a camera film. All the surrounding light that comes from the environment, it gets focused to this retina or the camera film by a lens. We have a lens inside the eye that solves this purpose. So all the ambient light, because of this lens, get focused on the surface of the retina, which works like a camera film. And this is the real picture of this retina, where there are several layers which are compact each other and remains in a very dry and dehydrated state, and we get a very crisp picture on the retina. So this is how our retina looks like. This is a nerve of the eye. This is the optic nerve. These are the major blood vessels that run on the surface of the retina, and these are the small tiny blood vessels which are going further to supply. These are the visible blood vessels. In between these visible blood vessels, there are numerous small tiny blood vessels which supplies each cells of the retina. These are so tiny that we cannot see them with the naked eye, but these are the last blood vessels or last pipeline to the last cells of the retina. So what happened exactly? If the blood sugars are raised for long time, it is this raised blood sugars, it works like a toxin to the body. Though it is not very appropriate word, we know that the glucose or sugar is like a petrol or fuel of our body. All the metabolism, all the energy, we get it from the sugar, or that is such an essential substance. But if it is high for the long duration, it works as a toxin. In I'm talking in a very layman words to explain in a better way. It makes the blood more sticky or thick. It is less fluid, and we know if the fluid is thick and viscous, it will flow less slowly in the blood vessels. Same time, it causes damage to the blood vessels. Blood vessels become sticky for the blood cells, and it get weak and outpouch. In simple words, we can say that the blood vessels get rusting. It is like a metal pipe that is in our washrooms, and suppose they are getting the rust. So the blood vessels are rusty and blood is thick and viscous. These two changes happens in the diabetic patients that occludes the blood vessels. So the blood is not flowing in these tiny blood vessels. As a result, the blood vessels get ruptured and we find some blood on the surface of the retina, and the surrounding area which was supplied by the blood vessels get blocked and get ischemic, and now they are almost died areas, or they are not viable areas now because of lack of blood supply. These leaking blood vessels or the rusty blood vessels causes edema or water surrounding in the surrounding retina. So as I told you, retina is like several layers which are dry, hydrated, compact. But once the blood comes from the rusty blood vessels, you see this water fluid cavities forms in the retina. Retina become like a spongy or cheese type. So the light which goes in these layers get disturbed, and person see the blurred vision. So now we understand that because of the diabetes, blood vessels ruptures, blood comes in the retina, and it leads to fluid accumulation in the retinal layers. This ischemia, when the blood is not going into the eye try to get more and more blood. In this attempt, I secrete some chemical. One very important chemical for the management aspect is vascular endothelial growth factor, or VEGF, is secreted. The body try to get more blood and it secretes this chemical. So more and more blood vessels forms on the surface of the retina. It is a compensation. Body try to compensate it. But unfortunately, these blood vessels are not normal. They are fragile blood vessels, abnormal blood vessels, tiny blood vessels. They can rupture by its own. And once these blood vessels ruptures, a huge amount of the blood comes in the eyeball and it blocks the vision. we see it as a vitreous hemorrhage. So the patient see the black dots in front of the eye. Sometimes it is so huge that it blocks the entire view. The blood vessels later on, the abnormal blood vessels that forms in the eye, they contract later on, like a scar or like a scab. These blood vessels contract, and when they contract, they pull off the surface of the retina from the layer of eyeball. So all blood vessels are contracting, pulling the retina and distorting the retina. And it is something we say as a last stage or very advanced stage of the diabetic retinopathy, because you can see that if you want to pull the retina back, we have to cut and trim all these fibrous bands, and it is such a very difficult situation. So we understand that patient may have a normal vision with the diabetes but have a hemorrhage on the retina. That is the early sign. Or patient may have a leaky blood vessels with the fluid in the retina that disturbs the vision. We say this entity as a macular edema. Or patient is having a blood and the abnormal blood vessels inside the eye that affects the vision. So now comes, what are the other risk factors for the diabetic retinopathy? So the most important risk factor is duration of diabetes. See, blood sugar levels which are raised, which are for long time, that act as a toxin and causes the damage of blood vessels and causes change in the blood itself. But these changes doesn't come overnight. It takes years together. I can say at least 5 to 10 years it takes to get some damage in the eye. So the good thing is that if the patient get diagnosed as a diabetes, very next day he comes to me and say that, doctor, I got diabetes, am I going to get blind? No, you'll not get blind, because this changes takes time. And if we control the sugars, these changes will never happen to you. So that's why I'm saying diabetic retinopathy is preventable if you diagnose it early, because the changes are so slow and it comes so late that you have a plenty of time, maybe 5 to 10 years. If you remain good, these changes will not come in your eye. If we control the very good things about this thing, like we are talking so negative, but there's some good aspects also. If you have a diabetes, if we control the diabetes well, you will not get the retinopathy. It is not just the retinopathy, you will not get the other problems like nephropathy, neuropathy, your kidneys, nervous system, nothing will get affected. One more good thing, if you have a diabetes, you have a diabetic retinopathy as well at the early stage. But if we start a good control, this retinopathy can stop progressing or it can reverse back as well. So good diabetic control can prevent the complications, or even it can reverse back also. So the one good idea is, like, some patient comes that I have a 20 years diabetes, but I am very well controlled for last 3 months, but why my vision is going down? See, the blood vessels are already rusty. Blood is also so sticky, and it happened for years together. So it will take time to reverse. So better idea is check the HbA1c. That is something which gives us an average idea about the sugar in last 3 months, and keep it in the normal range. And rest assured, you will not get any complication. The diabetic patients, they may have a coexisting blood pressure. Actually, blood pressure makes the blood vessels smaller or narrower. When you have a high blood pressure in the body, it reflects like that, it makes the blood vessels more narrower. So damaged blood vessels, when get more narrower, it causes more blockage in the blood flow. So we have to maintain a proper blood pressure. Same time, we have to take care of the lipid or the cholesterol in the body, because cholesterol again makes the blood more viscous and get deposition in the damaged blood vessels. Other than that, smoking, anemia, alcohol intake, obesity, and nephropathy, coexisting nephropathy are the risk factor for diabetic retinopathy. So there's one very general question comes in that when should be a diabetic patient is screened? Like if suppose you have a type 2 diabetes, that is the most common. I've discussed about a type 2 only, like that we get after 30 years of age. So no need to get panic. We have a, if we diagnose timely, there are less chances that you have a diabetes at the beginning, but still sometimes diabetes remains silent for a couple of years and patient is not aware of it. So whenever you get diagnosed as a diabetes, kindly check your eye for the diabetic retinopathy. It may be there. Second very important question point is the pregnancy. If the lady is pregnant and if she get if the lady is having a diabetes and she get pregnant, then there are chances that diabetic retinopathy progress very fast. So we have to check her every 1 to 3 months. But the more importantly, we see the patient who are having no diabetes but get pregnant, and during the pregnancy blood sugars are high. We say it as a gestational diabetes, and once they hear about the diabetes, they feel so depressed. But as I explained you, diabetes, any complications to happen, it takes years together. So just relax. It is a transient thing where the blood sugars are raised. We check after 3 months of the delivery, where there is no need to panic. There are no chances that you will get diabetic retinopathy immediately. So how we investigate and how we diagnose the patients with diabetic retinopathy? The pupil, that is the central part of the eye, it is a window to the body. Why the window is the body? Because by peeking inside, we can see the live blood vessels, how the blood is flowing. So we have to open this window, or we need to say dilate the window, so that we can more and more area of the retina. So the most important investigation for a diabetic screening is eye examination or retina examination or fundus examination or dilated fundus examination. So the key word is dilated fundus or retina examination, where we check the blood vessels directly and see is there any blood on the surface of the retina. There is one another investigation, that is optical coherence tomography. The short form is OCT. OCT is like, I showed you the picture. It give you a real-time picture of the retina with the resolution of 2 to 3 microns. So even a slightest change, slightest fluid in the retina, we can pick with this very sensitive, very specific, very repeatable investigation. Actually, there is one another investigation we say is a fundus fluorescein angiography. We know that the blood vessels are rusty, they are leaking, and we know that certain area of the retina is not getting blood supply because of the damaged blood vessels, and we know that there may be some abnormal blood vessels. This all we can check by this investigation, where we give one specific dye or medicine inside the in the veins by the intravenous route, and when this dye along with the blood comes in the eye, we see how the blood vessels are behaving. A brief about the classification. The classification, I'll not go in detail, but we understand that when there is a fluid in the retina, we say it is a diabetic macular edema. So diabetes can be with diabetic retinopathy can be with water in the retina or macular edema, or without macular edema. And same way, there may be so much lack of blood in the eye that body secretes VEGF, and now there is a abnormal blood vessels in the eye. The technical word for abnormal blood vessel is neovascularization. So patient may have an abnormal blood vessels, we say as a neovascularization, or proliferative diabetic retinopathy, PDR. So we can classify the diabetes as patient who are having PDR, like proliferation or neovascularization or abnormal blood vessels, that is the advanced stage, or patient are having some hemorrhages on the surface of the retina like this, but there is no abnormal blood vessel. We see it as a non-proliferative diabetic retinopathy. How we treat it? The one treatment is laser. Like suppose a patient is having a macular edema because of the leaking blood vessels. We point out what are the blood vessels are leaking, and we have one laser technology. We put a lens on the eye, we put a laser beam and focus to the abnormal blood vessels, and this laser burns the abnormal blood vessels, so the leakage stops. Very effective treatment, but it is having some limitations. But when we do it, it works wonderful, painless, no long-term side effect. Effect comes in 3 to 4 months, but once the effect comes, it is permanent. But the most preferred, or we can say the treatment of choice, is the anti-VEGF injection. The VEGF is the same molecule that secretes in the eye when the eye is having less blood in attempt to get more and more blood vessels. So this VEGF is the we can say the culprit in this whole situation. This VEGF, we have few molecules which are the antidote or antagonists to the VEGF, the namely ranibizumab, aflibercept, the newer one is the brolucizumab. These injections are given directly inside the eye. So the chemical coming directly in the eye, and it works on the retina. The effect is wonderful. It is a magical drug, or we can say dramatic effect. But the action lasts for 4 to 6 weeks. Thereafter, we have to repeat the injection. So the patient who are familiar with the situation, they say that though it is wonderful, but we have to take injections often. Often means every 4 to 8 weeks. And it is diabetes is such a long disease. The injections are really cumbersome to get so often. But good thing that if you control well, the mean average is 9 injection in 1 year. But every year thereafter, second year 3 injection, third year 2 injection, fourth year just 1 injection, and fifth year no injection at all. So average number of injections are more frequent in the initial few months or initial 1 year. Thereafter it reduces and the disease improves. So but what about the situations when there are abnormal blood vessels in the eye that sometimes ruptures and causes hemorrhages? For this type of situation, we do a laser that stimulate and burns the area where there is no blood supply. So if we damage or stimulate the damaged area, so less and less VEGF production will be there, and the retina gets improve in the overall circulation, and the hemorrhages and these blood vessels can regress. But sometimes there is a hemorrhage in the eye, or there is a traction on the retina which is causing retinal detachment. For all these situations, we have to do a surgery. Surgery is pars plana vitrectomy. We have some needles. By these needles, we go inside the eye. Needles are very tiny. It is just slightly larger than the insulin syringe, but it is very smaller than what you get for the routine injections. It is lesser than what we get for the routine injections in the body. Very tiny, fine needles, and these needles are used to remove all the water and the blood from the eye, and we remove all the traction, scar, and abnormal blood vessels, so retina gets back to the normal shape. So I'll just say that these are few patients we managed. So the one dictum is that if you fought with the half-hearted, the battle is almost half lost. Why I'm saying so? So many of the patients with the diabetes, they come, they take the treatment, but they don't take the treatment regularly. So this is one patient who had has a diabetic retinopathy, not in a very advanced stage. We did the laser, but she didn't take the proper treatment, proper laser. So you see that a tiny blood vessels grow even over the blood vessels, and then she landed up with the hemorrhages in the eye, both eyes. Though it was started with the early stage, but it rapidly progressed in the terms of around 2 years. She was less motivated, not willing to take the proper treatment. But this is the same, and eventually the patient lost the vision. But here you see the patient, who similar type of patients came in 2017. Diabetes was not so severe. He come in between, don't take a proper treatment, so ended up with the hemorrhages and advancement of the disease in just 1 year and few months. But once he lost the vision because of the hemorrhages, he was young male around 45 years of age. He got he understand the severity of the disease, and thereafter he started taking the proper treatment. And here you can see, from this situation the retina get so clean, and as the disease, as he's under the treatment still now, and by seeing the clinical picture you can understand that disease is now less severe in the eye. There are no hemorrhages, there is no blood, all the blood vessels is regressed and convert into the fibrous scar. So what I'm trying to say is that if you know the enemy and you know yourself, you need not to fear. We have such a wonderful treatment. We can prevent the blindness or loss of the vision. Even there is some extent of loss of vision, we can revert it back. We can prevent all the complications. What you need is just to check properly, timely, and take good control of your lifestyles, increase physical activities, reduce the calorie intakes. That's it. Diabetes is something that we can easily win. This challenge we can take and we can overcome. So with this, I'll just say that it is the eye examination that you come for the diabetes is not just for the diabetes. We get so many information by checking your eye, because eye is not just an organ, in the sense that this is the only organ where we can see how the blood is moving in the real time. And with the new artificial intelligence, development of the software, we can, by seeing the blood vessels, their thickness, their lumen, flow of the blood, we can check the risk for the future stroke, cardiovascular events, dementia, your probability for getting paralysis. So many information we can get by just seeing your fundus or the retina. So I cannot give more emphasis than this. Stay maintain a proper lifestyle, and once you have any deviation in your blood sugar, take a physician's consultation, and take an ophthalmologist opinion as early as your diagnosis as a diabetes. So thanks a lot for your kind listening, and I welcome you for any questions and any queries.
Thank you, Dr. Mohit Jain, for the very informative presentation, Doctor. We thank you for your time and for sharing your knowledge and expertise in educating us with diabetes, eye care, and retinopathy. I am sure each attendee has learned many things from you today. Now, we wish to call in Dr. Wilco to take up a few questions from the participants.
Thank you, Laleen. Thank you, Dr. Mohit, for a wonderful session, and you have given us very light and easy to understand a session, and definitely you have given an emphasis to take care of your eyes, because eyes is a window of insight, like you mentioned. It's a very good line. I'll definitely use this line whenever I talk.
Thank you. Thanks for your appreciation.
Yeah, thank you, sir. Sir, there are a few questions which we received on the email and in chat box also we are getting. So, Manpreet is asking, I am diabetic. I also have high blood pressure. My glucose levels are good, but my blood pressure fluctuates. Am I at risk of retina problem? Doctor.
Yes, you are at the risk of retina problem as far as the blood pressures and the sugars are not well controlled. So that is also a myth. Well controlled doesn't exist. You know,
Hmm.
nobody is perfect in the life. You cannot have a 100% normal blood sugars each and every day, and the same is the blood pressure. So we have to be realistic in the sense we have to check HbA1c, that is the average of the 3 months, that should be in the normal range. We need not to check blood pressure on the 4 times in a day. Just check once in a week or twice in a month. It should be in the normal range. So slight fluctuation is very much acceptable. Need not to worry about it. Retinopathy comes in the eye doesn't mean that you will lose the vision. We have a good treatment for the retinopathy. So from diabetes to development of diabetic retinopathy with good control, the time is 20 years. And once you develop the retinopathy, and loss of the vision is not possible if you do a moderate and good control. Loss of vision only happens when there is ignorance. So need not to worry. If you are in a good healthcare, you are associated with a good healthcare, slight fluctuation is fine. Need not to worry about it.
Thank you, Doc. There is another question. Harshad is asking, my father is 50 years and he has retinal detachment with proliferative retinopathy and was suggested for a laser surgery. He is worried. Is laser surgery safe?
Yes. So actually, laser surgery is one of the most safest and permanent treatment for the diabetic retinopathy. Laser surgery actually, burns and stimulate the dead area. Like suppose you have unfortunately, suppose you have a severe diabetes and your fingers are not getting the blood supply and they get gangrene. So the treatment is we have to cut the finger. So we cut the very small portion of the finger, but the rest of the hand and the body is preserved. The same way is with the diabetic retinopathy. The area of the retina which is not getting the blood supply, getting a gangrene. I'm not saying the gangrene exactly. The instance it is making some toxic chemical like vascular endothelial growth factor. So the best way is to burn that particular area. That is done by the laser. So the effects are permanent and significant. It is one of the gold standard treatment. So don't hesitate, go for the treatment.
Great, sir. Mr. Sarfraj is asking, my father is 55 years, he is diabetic and recently he was diagnosed with glaucoma. Will it affect
You are muted, Dr. Wilco.
Doc, Sarfraj
Yeah,
is
I got the
asking,
question.
yeah,
See, actually, again, with the basic understanding that glaucoma is a very common disorder. 1 in 1,000 person is having a glaucoma. And again, glaucoma can cause loss of the vision if it is not controlled. And in diabetic patient, we see glaucoma more often than the normal. In diabetic patients, glaucoma progresses faster than the normal person. But again, if it is ignored, if it is overlooked, but if you are taking proper medications for the glaucoma, proper treatment for the diabetes, there is nothing that can cause the loss of the vision. These are the old days when we have not significant medications or the treatment options. Now with all such advanced technology, loss of vision is not possible.
yeah, that's good, sir. Harshad is asking his personal question. I'm suffering from vision disturbances after being COVID positive, like floaters when he moves head side to side. Is it serious?
Yes. If you're seeing some floaters which were not there before, but now it has appeared, especially after COVID, then you should come and check your retina. Because it suggests that there may be some immune reaction in the eye, which is presenting like this. So 100% don't ignore it and get your dilated fundus examination.
Okay. Mr. Muzan Hussain is asking, he's 35 years old and sugar is controlled, but I'm suffering with dry eye and allergy. I cannot survive without drops. He's using iCross 0.4%. Is it be permanent or it can be treated?
See, actually, the dryness is the nature of the body. Suppose if I have a dry skin, I have to use moisturizer in the winters. There is no other option. There is no other way. And in summers, I'm fine. But in winters, I have to place 4 times moisturizer on my hand and the face. Same way is the eye. It is the surface of the eye which is having allergy in the dryness. It is seasonal. It fluctuates with the season. It is affected with the eye stress, like excessive computer work, excessive driving where there is a flow of air by the AC on the face, or working late nights where there's a lack of sleep, or emotional or physical stress. So these are the things, and it is not a serious disease, but you have to put the eye drops. Is like a moisturizer, nothing to worry about. Again, there are advances. We have punctal plugs. These are small tiny silicone devices that we place on the eyelid, not in the eye, on the eyelid, and it increases the natural tears in the body, natural body tears which are good in the proteins, enzymes, antioxidants, and it increases the eye surface. So you can go for that. So the need for eye drops will reduce dramatically.
Oh, great. That's a good solution. Doc, overall, you have told everything. You have explained everything. My personal question as a takeaway, you have already given a takeaway. Today, we are talking about diabetic retinopathy. Overall, if we talk about eye care, eye health, whether it is diabetes, whether it is dyslipidemia, whether it is high blood pressure or XYZ comorbid conditions, what you give a suggestion to take care of the eyes and how?
That's such a very generic question, but I'll divide it in that, we have to divide it in the age groups. So suppose the patient is below 20 or the early teens. We're talking about the kids. So kids are actually most of the time on the digital devices. Unfortunately, there are studies, and after the studies, whatever they do, are they doing on the digital devices. That gives the strain in the eye, and excessive digital work is associated with the glasses, onset of the glasses, and rapid progression of the number or the glasses in the eye. So all the kids below 20 years of age, they have to reduce the time they spend on the computer screen. They have, because it can increase the glasses number. So they should work more in the daylight because darkness increases the glasses. So I suggest them that whatever homework, whatever you want to do in the morning time rather than the late night. Stay in an area where there's a good daylight, and don't sleep, don't stay awake late in the night. Try to make a habit to get up early in the morning. From 20 to 40 years of age, where they are the computer professional, they are active worker, they have a very busy life. If they feel dry eye symptoms, they have to use the lubricating eye drop, because in this age group, we have a dryness and we ignore it. So eye surface get rough and it manifests with the inflammation after 40 years of age. So if you have a dryness, don't ignore it, take a proper treatment. There are something known as computer glasses, computer vision glasses. These glasses are having one coating that prevents the light from the screen, and it prevents the UV light that is coming from the ambience. Same way, they have some power that helps in the computer and the mobile work. From 40 to the 60 year of age, this age group person, after 40 year of age, they need extra help for the reading, we say as a presbyopia. So all the patient who crosses 40 years, they should come and check for the reading glasses. 40 years of age is the time where patient get glaucoma. Like it is the time where generally glaucoma starts. So they have to check their eye pressure and they have to check their optic nerve. So this test should be checked every 5 years. I check the glass power, eye pressure, and optic nerve examination between 40 to 60 years. Over the 60 years, patients are prone for the cataract, age-related macular degeneration, glaucoma. I'm talking about very grossly. So to check these things, patients should check once in a year or once in a 2 year. And whenever they feel any changes in the eye, in terms of they feel like the one gentleman told that the black spots coming in front of the eye, if they feel the lines, straight lines seems wavy, or they feel that there is excessive darkness in the room and they need extra light, these are the signs that something is going wrong and they should report immediately. But otherwise, there's nothing to worry. There is nothing, fortunately, there is not a single disease, or can say very few disease that can lose the vision immediately overnight. There are long period of time for every disease to cause loss of vision.
Thank you so much. You have given the basic guidelines so that everyone can follow. There is very interesting question. Najma is asking. This is out of Eyecare, but she's asking this question. Young girls are using eye lenses. Does it affect the eye?
See, contact lenses, the newer generation contact lenses that we have are pretty safe. I never discourage patient for the contact lenses, but you have to understand, you are putting something which is not natural. We are putting something over the eye skin, and you are putting it for the long time. That is not good. You can use contact lenses for a few hours and few days in a week, but if you are using it in morning till late night, or you are sleeping with the contact lens, it is not recommended. Second thing, when you use the contact lens, it can be a source of the infection. So clean your hands thoroughly before you place the contact lens. Never do swimming, never do overnight sleep with the contact lenses. More importantly, if you feel your eyes are tired, eyes are red, eyes are watery, don't put contact lens. Skip the contact lens that particular day. Otherwise, it is fine, it is safe.
Yeah. Mr. Sarwar is asking, he sees halos and glare last 1 year. No doctor diagnosed until now. Please help. I think the black spots and floaters, he's talking about that.
What is the age of Mr. Sarwar?
Mr. Sarwar, you can tell your age.
Okay, I can guess the age, no worries. So actually, the particular question is glare and the halos. So I'll go with the most common reason is the dryness. Then astigmatism, that your lens power is not corrected. Then there may be some changes in the lens, maybe have some early cataract. So these are the three most important reasons for the glare and the halos. Rare is high pressure in the eye, which is known as a glaucoma. So if it is persistent, then definitely you should check your eyes.
There is one more question. Dr. Veena is asking, does dryness of eyes cause bad effect in long run?
Yeah, as I explained that between 20 to 40 years of age, patients are having dryness and they avoid it. I'm not saying what is written in the textbook, it is what I see in the clinical practice. This actually, when the surface, suppose you have a dry lips, then it get cracks and it get inflammation. So same way, if your eye surface is dry, it leads to some inflammation. And this inflammation remains for the long term, then it disturbs the entire surface of the eye. And we understand that, if our cornea, which is like a glass in front of the eye, like you are driving a car and there is a glass, that the same thing is the cornea. It should be pristine clear. If it is inflamed for the long time, it gets hazy. And you cannot replace your car mirror so many of the time. You cannot replace your cornea. It is a part of your body. Simple dryness can lead to corneal haze, not in the 1 or 2 days, but over the decades. So treat your dryness properly.
True. There is one more question. Dr. Madhurima is asking, what is the treatment for recurring retinal hemorrhage after COVID? You can take it without COVID
retinal
also.
hemorrhage is something which cannot be. We have to rule out what is the reason for it. Recurrent retinal hemorrhages, there may be something vasculopathy, maybe something, either it is a vasculitis or diabetic retinopathy, or there is a PVD induction. It needs a proper consultation with the doctor, with a close observation and close follow-up. cannot be taken lightly.
Yeah, true. I think that the questions are over. So thank you so much, Dr. Mohit. I will forward it to Lailin. Lailin, take it forward, please.
Thank you, Dr. Wilco. For our participants' information, if you have any eye concerns, Dr. Mohit Jain is available in our ophthalmology clinic in RAC Hospital. You can call in our hospital and take an appointment with him. Once more, we thank each one of our participants for taking part in today's webinar. Special thanks goes out to Dr. Mohit Jain. Thank you, Doctor. Dr. Wilco, members of the organizing team who are working hard behind the scene, thank you. For the information of all, the next webinar will be on that is next Friday, 4th of November, 2022. Time will be 11 a.m. to 12 noon. We have our speaker, Dr. Madhurima Deshmukh. She is the health and wellness and fitness consultant of ProLife. We're looking forward to see you all on our next webinar. Thank you all.